Brace yourself, ladies and gentlemen. Call up a friend or family member, let them know that it's 9 o'clock. And 15 of the healthiest, diabetes-friendliest minutes you will ever hear on your radio is about to start on VOB 92.9 FM this Saturday morning. And the big questions that we have for you today is... do you know what your diabetes stats are?
I don't know.
And do you know the risk factors for diabetes?
I would like to know now.
And are you ready for the next 8-week challenge? All of these questions and more will be answered in today's show with the compliments of the Barbados Diabetic Eye Screening Program, the Maria Holder Diabetes Center, and the bank that helps you achieve your financial challenges, Republic Bank.
Dream a dream and watch it become a reality. You can do anything. Pull up a chair, come sit and come share with Republic Bank. You can do anything. Yes, we're the one for you, making dreams come true. We're the one for you, your partner for life. We're the one for you, Republic Bank.
Good morning, peoples. This is Peter Boyce here, and right off the bat, when is the last time you went and get your eyes checked for diabetic retinopathy? You know you're supposed to do that every year once you are diabetic. Don't say you can't afford to go because you don't want to spend the money, and then next thing you know, you end up going blind and you can't even see the money. Make sure and call 417-0305 and make that appointment to go to the Maria Holder Diabetes Center located in Warren, St. Michael.
Wait, that's where there's also a fine diabetes specialist, Dr. Diane Brathwaite.
Sure is. And speaking of Dr. Brathwaite, here she is to give us our health talk for the day. Morning, Dr. D.
Hello, good morning. Welcome once again to another show from the Maria Holder Diabetes Center for the Caribbean, and of course, our host, Peter Boyce, and I never forget Alfonso. So I hope you had a wonderful week.
Alfonso here, Dr. D. I had a good week. How was yours?
My week was interesting. It was a bit tiring and challenging, but you know, once again, we always just give thanks for getting through the week.
So what's on today's show?
So on today's show, we are gonna get back to that challenge for the week that we're throwing out there to the people of Barbados, and then we're gonna share some education with you. And this week, I want to challenge you to know your stats.
You mean the cricket stats?
Know your stats for diabetes.
Oh, okay. So what I mean?
That means, number 1, are you at risk of diabetes? Number 2, do you have pre-diabetes? Number 3, do you have undiagnosed diabetes? And of course, number 4, if you have diabetes, are your numbers controlled? So let's know your stats. Today, I'm going to talk about the risk factors for diabetes mellitus. There are actually so many risk factors for diabetes, and it's important to know if you're at risk, because if you are at risk, first of all, you can get a diabetes screening test earlier to detect it at a very early stage where it is most likely possible to put it in remission. And of course, we're talking about type 2 diabetes, remembering that type 1 diabetes isn't preventable per se, and you cannot put it into remission by lifestyle measures. So let's think about the risk factors for type 2 diabetes. So believe it or not, the age has fallen from 45 to 48 to 35. Are you over the age of 35 years? If you are, well then yes, discuss with your doctor the timing of your first, or hopefully not your first, diabetes screening test. Are you physically inactive? Many studies have shown that the rates of physical inactivity are actually quite high in modern day populations, and the Health of the Nation 2015 study showed exactly the same thing both among adults and children. So physical inactivity is a risk factor for diabetes. Do you have a first degree relative with diabetes? So for example, do either of your parents have diabetes? Do siblings have diabetes? Having second degree relatives with diabetes is a risk factor, though the risk is slightly less than if it's an immediate first degree relative with diabetes, but there definitely is a risk. Just of note, if you have diabetes in the family occurring at an earlier age, say under the age of 50, under the age of 40, please understand that there's something called a generational, almost like jump, and that means that offspring of these persons may get diabetes as much as 10 years earlier earlier than onset in the parents. So that 35 years does not apply to persons like that, and they may need to start checking from a much earlier age. Are you a member of a high-risk ethnic population? African American, Caribbean, Latinos, Native American, Asian Americans, Pacific Islanders. Well, the truth is, in Barbados and the wider Caribbean, most of us are actually at a very high risk because of our ethnicity. Women who delivered a baby over 9 pounds. Okay, so if you're a woman and you had a large baby, or if you had gestational diabetes, that is diabetes in pregnancy, which was new, please note that the infants of persons like this are also at risk of diabetes, and there are some guidelines which indicate that these children should be screened for diabetes in early adolescence, probably from around the age of 11 or 12. Once again, just stay informed and discuss with your care provider. Other risk factors for diabetes. Now we're thinking about the things also that are medical. So yes, diabetes does go hand in hand with other medical conditions, and some of these things, as we know, are high blood pressure. Rates of high blood pressure are very high in Barbados. So if you have high blood pressure, consider if you need to get diabetes screening. Do you have something called dyslipidemia? Do you have a low HDL cholesterol, high triglyceride levels, very high LDL levels? These are reasons you should consider having screening done as well. Women, obviously, who've had a history of polycystic ovarian syndrome are also at risk of type 2 diabetes, because insulin resistance is the underlying factor behind polycystic ovarian syndrome. And persons who have had this will need to screen at an earlier age before that 35-year-old cutoff. Obviously, if you have had a diagnosis of pre-diabetes, you would be at a high risk of diabetes. Those of you who know me would always remember hearing me say, well, this is my opinion, there's no pre-diabetes. Diabetes is a spectrum condition, and so therefore the same damage you can get in diabetes, it starts in the pre-diabetic phase, and pre-diabetes should always actively be managed. But if you had a diagnosis of pre-diabetes, do not delay following up on lifestyle modification, interventions, medication if required, and rescreening. If your waist circumference is large, or if you have a higher body weight, or you know you've put on more weight recently, consider having that screening done. Or if you have had a history of cardiovascular disease or a cardiovascular event like a heart attack or a stroke, angina, heart failure, etc. There are some other associations, obviously, with having a higher risk of diabetes, and some of those things are going to be disability, mental health condition or depression, insomnia, and that means not getting enough sleep. If you have had a history of childhood obesity, and yes, vitamin B deficiency has crawled its way into the list. This is quite an extensive list. Some things are associations, but most of the things I have mentioned are actually established risk factors. So don't omit to get your checks done today.
Thank you, Dr. D. So I hope everyone out there takes Dr. D's advice and get your checkup done at the Maria Holder Diabetes Center. And you heard Dr. D mention insomnia, which takes us into our song of the day this Saturday morning. This is Insomnia by Rupi. Compliments the Maria Holder Diabetes Center and Republic Bank.
Down the road now. Down behind the truck. Can't believe my love. I'm so lucky today. So much pretty girl. Must be carnival. Must be carnival. Wow. I can't believe it's carnival. Just look around. So much pretty girl. Drinks in my hand. Behind the van. Beijing and Jimmy together as one. I can't believe it's carnival. Just look around, so much pretty girl. Drinks in my hand, behind the van. Beijing and Trinity together as one.
The Maria Holder Diabetes Center.
Now we chill, drinks in my hand, like a sip. All the pretty girl by them hips, chill, chipping, and we chill, drinks in my hand, like a sip. All the pretty girl by them hips.
Lord D, before you go, You got any stories about people that benefit from going to the Maria Holder Diabetes Center to help encourage people to go? Call later here.
So I always want to have a little patient inspiration corner, and I want to share 2 quick stories about success cases that I've seen within the last 2 weeks. And first of all, I wanted to highlight a lovely lady who I met who was gonna give me an interview, then told me she was too shy, but I wanted to just congratulate her publicly. She was able, after an extended period of time, to finally understand the nutrition recommendations, the basics of which we highlighted in last week's session with Victoria Cox. And I sent her to Victoria, and she put those things into place. And in 6 weeks, this is a woman who's had diabetes for over 30 years, taking insulin. In 6 weeks, she lost 7 pounds, and all of her blood sugars were normal. And she dropped her HbA1c by a whole 3% in only 6 weeks. Remember, HbA1c is checked generally every 3 months or so. If she continues on that way, I can see that we're going to be starting to trim back insulin and even more. So congrats to her. My other big congrats story is to a lovely lady who I met yesterday, 81 years of age, comes in with her son. She actually came into me first, obviously on a walker. Her health really wasn't doing the best, but her son took the bull by her handles and started to get her going on some physical activity. And not only did she come in with her HbA1c drop by 1% and to target, but she also spurted through my door, sat up, jumped up, and she had so much energy. I was like, oh my gosh, you're like a different person. Do not undermine the benefits of physical activity, regular physical activity, and a healthy lifestyle. Next week, we're going to talk more about physical activity and all the benefits and why it matters to you as a human and as somebody at risk of diabetes or living with diabetes. So for now, that's me, Diane, Dr. B, whatever you want to call me, signing out. Take care, and I want to wish you an absolutely wonderful weekend. And before I go, I want to remind you, of course, we have our nice little foot clinic, foot corner. We have new staff, we're getting some new equipment, and I want to just say this week I noticed more people seem to be activated to come and have conditions related to their feet checked out early, and I'm really encouraged by that. It made my week really busy, but what it means is that people are actually getting the message. Check your feet early, check your feet regularly. If there is an issue, please do not ignore it and don't take matters into your own hand and cause a problem. Don't forget, we have our artery circulation screening tools, PAD screening, something that's so important for persons living with diabetes, persons over the age of 65, or if you're living with hypertension or cholesterol issues, or you've had a cardiovascular event in the past. Remember, early detection puts you in the driver's seat to control things in your life. Be proactive. Have a wonderful weekend. Take good care of yourselves. Bye-bye. So for this week's challenge, you can put Know Your Risk, hashtag Know Your Risk. You can also have another hashtag, Know Your Stats, STATS. And why not tag us, the Barbados Diabetes Foundation, onto social media, on Facebook or Instagram. Take good care.
For over 10 years, the Maria Holder Diabetes Center has been effectively serving the diabetic and pre-diabetic community of Barbados with a range of international standard health services, which include diabetic eye screening, vascular screening, nutritional advice, and consultations with diabetes specialists. So if you are listening to VOB right now and you have a diabetic-related query or you need to make an appointment, you can call 243-3937. The last 15 minutes you heard on VOB was brought to you with the compliments of the Barbados Diabetic Eye Screening Program, Republic Bank, and the Maria Holder Diabetes Center celebrating its 10th anniversary. Until next time,
Drink more water. Did you know nearly 1 in 5 adults in Barbados have diabetes? Did you know diabetes is one of the leading causes of vision loss in the world? Regular eye screening can save your eyes. Contact the Barbados Diabetic Eye Screening Program today.
Dream a dream and watch it become a reality. You can